Next speaker is Frederick Kusi. He's going to speak on diagnosis and staging of limbal stem cell deficiency. What did we agree on?
Yes, first of all, Dr. Deng, thank you very much for the invitation to talk about limbal stem cell disease. If I could have my slides, yes. The concept, I have the same problem again, that doesn't move. Maybe we can get, nothing happens. Got the other control.
There was a control.
There was a control. Okay, now it moves. Okay, finally. Okay, I have no commercial relationship regarding to this talk. If we talk about limbal stem cell deficiency, it's important to recognize the limbal stem cell concept. We know from early on that the limbal palisades or forked harbor cells which are important for the regeneration of the corneal epithelium. And with modern techniques, we can actually highlight the stem cells in the limbus as well as the surrounding cells which compose the niche. And if we have a healthy niche and healthy stem cell, we get unimpaired regeneration of the corneal epithelium, which means that the stem cells are the source of the regeneration, and the stem cells also keep the conjunctiva in place. Whereas if the stem cells are lost, there is the process of conjunctivalization, which means that the conjunctiva moves in and the characteristic picture of limbal stem cell deficiency arises. We can reverse the process of limbal stem cell deficiency by either limbal transplantation or ex vivo expanded grafts. Whereas the terminology of limbal stem cells is very uniform, there is a marked heterogeneity regarding the clinical picture of limbal stem cell deficiency. There are more than 125 studies investigating therapeutic measures, and they all apply variable criteria for diagnosis. Most talk about conjunctivalization, but there is heterogeneity also regarding the staging and the outcome criteria. And we know that there is a lot of heterogeneity regarding the confusing picture of this disease. So since there's no uniform definition and there are no uniform criteria, there was a group of corneal specialists who set out to establish a consensus. And the consensus is depicted in this diagram by Dr. Deng. There were 3 subcommittees formed. The subcommittees met several times. A broad consensus was established, and then a writing committee put together 2 papers, one on the definition and classification, which is out already, and the other one regarding treatment, which is under review. This is the first paper regarding the global consensus. It's published in the Journal of Cornea, and it gives, first of all and importantly, a new definition. By this definition, limbal stem cell disease is an ocular surface disease caused by a decrease in the population or the function of limbal stem cells, which then lead to an inability to sustain the normal homeostasis. This then leads to signs of conjunctivalization, which is the replacement of the cornea by conjunctiva, and signs of epithelial dysfunction such as epithelial abnormalities, neovascularization, inflammation and scarring, and consequently the vision is impaired and pain and the quality of life is decreasing. So how do we diagnose limbal stem cell disease? First, the clinical picture. We have, in fact, to look for conjunctivalization, goblet cells on the surface, and since we do not see them, we have to rely on changes of the epithelial phenotype, which are characterized by irregularity and haziness, by the existence of blood vessels, by the loss of the limbal palisades, as well as persistent and recurrent epithelial defects and subepithelial fibrosis, ultimately decreasing the visual acuity. In addition to these signs, we have specific symptoms like pain, foreign body sensation, photophobia, and decreased vision. Especially if you think about invasive therapeutic measures, we think that you have to perform diagnostic tests in order to prove there's conjunctivalization, and the most important one is surface late staining. Surface laid staining is based on differences in the paracellular permeability between the cornea and the conjunctiva. Cornea to your left has a low permeability because the cells are tightly connected, whereas the conjunctiva is loose. And if you have the cornea to your left, the conjunctiva to your right, you apply fluorescent. The dense corneal epithelium prevents the dye to intrude, and in the conjunctiva, you see that the dye goes into the paracellular space. So after 20 minutes, you have delayed fluorescent staining, which can be shown in this picture. You see the staining to your right, and again on the right side, the delayed corneal staining. Finally, you can do a number of histological and immunochemistry tests to prove that there's limbal stem cell disease by either obtaining cells by impression cytology, which has been described for a long time with Alcium blue staining, or do a biopsy. Finally, we have modern techniques of imaging. The confocal microscope allows the same security as impression cytology. You can see the goblet cells here in the confocal and in the staining. And Sophie Deng's group has established the OCT, the loss of the limbal phalangates, and this is also a very important diagnostic test. Finally, the panel came across or established a new staging system. Stage 1 is characterized by healthy epithelium, corneal epithelium in the center, and various degrees of conjunctivalization in the periphery, whereas stage 2, the center is also diseased, and there is various degree of these changes in the periphery. Finally, stage 3 means a complete vascularization of the surface. So then, which are the diseases which can cause limbal stem cell disease? We have acquired limbal stem cell disease mainly by non-immune causes like chemical injuries, contact lenses, surgical interventions, trachoma, and drugs, especially glaucoma drugs. We have acquired immune-related limbal stem cell disease, which is most importantly the Stevens-Johnson syndrome, but also pemphigoid and other disease, curse versus host, and allergic diseases. And finally, we have idiopathic problems. And then we have a second group of hereditary diseases, congenital aniridia, and these fortunately very rare cases. So in summary, we have established a new definition of limbal stem cell disease. We think it's important to look for signs of conjunctivization on the surface and to prove the existence of goblet cells when you do invasive therapy. And finally, we provided a list of diseases which is based on the current literature. Thank you very much for your attention.
Thank you, Friedrich, for the great talk.